Withdrawing blood from a central line catheter. Verify your physician's order. You're going to wash your hands and don your gloves. Explain the procedure to the patient and answer any questions. First, you'll verify the correct patient by comparing the name and date of birth to the lab requisition, utilizing the patient's armband to do so. Determine which line will be used. If your patient has a multi-lumen catheter, you'll utilize the proximal lumen. Obtain all your supplies and stop any continuous IV infusions flowing at this time. You'll stop all fluids for 2 minutes. On multi-lumen catheters with clamps, such as a triple lumen catheter, make sure to clamp all lines that you're not collecting blood from to prevent contamination of lab specimens with IV fluid. Note that if you're accessing a dual lumen hemodialysis catheter, that you want to aspirate the indwelling heparin first. This can only be done with a nephrologist's order. So first we want to scrub the hub of the microclave cap using our Prevantix wipe. You're going to scrub for 5 seconds, stroking back and forth. You will then attach a 10 ml saline syringe and flush the line with all 10 to verify patency. With the attached flush in place, you'll withdraw 5 to 10 mLs of wasted blood from the catheter. Once you have obtained your waste, you'll discard in a biohazard bin. Please note that if your patient is unable to have blood return from their catheter, then you can change your patient's position, have them cough, or try to move their arm above their head. Once you've discarded your waste, you're going to use your Prevantix wipe again and scrub for 5 seconds. We will attach an empty 10 cc syringe, and we're going to slowly withdraw the amount of blood needed for the lab test. Once you have obtained your sample, you'll remove your syringe, and you're immediately going to transfer the blood using your vacutainer into your blood sample tubing. Please note the correct order of draw. You'll take your vacutainer with your blood specimen and insert it into the tube. This will automatically create a suction that will pull the blood into the tube for the proper amount that is needed to fill the ampule. Please note never to press the plunger to add more blood to the tubing. Once complete, you will discard in a sharp spin, and then the rest of the blood in the tube into a biohazard container. You will then invert your blood tube about 6 to 8 times gently. Do not shake vigorously. You will then scrub your line again with a Prevantix swab for 5 seconds. And then you're going to attach 10 mLs of saline, flushing using a push-pause technique to create turbulence to clean the catheter. Once you've flushed 10 mLs, you will attach a secondary flush after scrubbing for 5 seconds. And then again, instilling all 10 mLs using a push-pause method. We will then label our specimen at the bedside. Please refer to your policy for requirement documentation. and labeling of your specimen. Since this is a line draw, be sure to include an L on your labeling, time, date, and your Cerner logon and initials. After properly filling out and labeling your specimen, you will attach your specimen label to the specimen itself. You will then place your specimen in a biohazard bag. You will remove your gloves, wash your hands with alcohol. You'll send off your specimen and document accordingly.